Today's topic is striving for self-sufficiency through capacity building. And even as I was pondering, there were four thoughts which came to my mind, which was, if you really look at the philosophy of capacity building, it means different things to different areas. But in the area of healthcare, we look at four strong pillars, and the first one is a top-down organizational approach. The second one is a bottom-up organizational approach. So there are two variants to this whole capacity building exercise. And the third is more of an external partnerships approach. It's a relationship rebuilding approach that we have, where we strengthen relationships between organizations. And the fourth clearly is the community organization outreach, which is more importantly an area where existing people either build in relationships within the organization or they form new relationships. I think it's a good thing to actually take a step back and observe where we have been over the last 10 years. And I took the liberty of asking the Deputy Director, Mr. Dipankar Bhattacharya, to actually share with us what have we as an organization, as a body, as of like-minded individuals been doing for the last 10 years. And I'm extremely happy to share the journey that we've been having through Healthcare East for the last 10 years. Started off in 2006, which was at that point of time not an annual event, but a biannual event. And the first time we had Healthcare East in 2006, it was making of a tertiary healthcare hub. In 2008, the making of healthcare clusters. In 2009, experiencing Indian healthcare. In 2010, challenges ahead for the healthcare environment. In 2011, it was affordable healthcare, health for all. In 2012, it was progress through partnership. So if you see how this storyline has been developing, even for Healthcare East, the themes have been very carefully selected, where from an inclusive growth, we are looking in a divergent area, but converging at some point of time. In 2013, it was improving patient care through accessibility, affordability, and compassion. In 2014, it was a step towards better care for better infrastructure. In 2015, it was working towards health for all. And in 2016, it is going to be striving for self-sufficiency through capacity building in healthcare. Infrastructure in the eastern part of this world has really developed. And in this country, there's been a lot of infusion. There are many people over here who have invested and have grown the infrastructure. And we clearly know that for a system to work and work efficiently and effectively, it's extremely important that we have a talent pool. Both the central and state government have introduced important structural reforms in the last decade, and as a result of which, private enterprise, the sector has experienced unprecedented growth in the last decade. While capacity building has become a buzzword to address the challenges faced by the healthcare industry, we have a situation where currently 1 million, a whopping 1 million youth enter the Indian job market every month in India. That's a huge, staggering number, and this potential workflow is supposed to be happening over the next few years. Another thought that I wanted to share was India is expected to be home to a skilled workforce of 500 million by 2022. And the healthcare sector is expected to drive the growth of the economy as well as play a significant role in employment in this country. Something which is a cause of concern is that while some of us have been in the area of education and in healthcare education, it is reported that India would continue to witness significant dropout rates in high schools as high as 60%. And while the government is creating a lot of intervention to stem this, it would still be as high as 45% to 50% by 2022. It remains a challenge. And healthcare, while it's faced with a tremendous challenge as far as its talent pool is concerned, there's a lot of opportunity that we have, that we can explore at this time. So something which has been very close to a lot of people's heart is that we started off from CII, the supervisory skill competition for nurses, and this was started in the eastern region as a philosophy, as a concept, as an intervention, when we began to realize that the nursing force was really the force which was making a huge difference in our environment, in our healthcare environment. And this has really been accepted extremely well. And while I've been a part of this over the years, I've seen the participation from the organizations, and especially the encouragement which has been received by industry leaders for this initiative has really been unprecedented and extremely a great time of interaction and fellowship among the nursing community. 10 years ago, we used to talk about 2020, right? And a lot of our statistics, a lot of our deliberations, a lot of our valuations, a lot of our workings for ROI, etc., was built around what the world would experience, what our country would experience in the next 2 decades. And we started off this journey in 2000. And if we take a pause at this time, we'll realize that 2020 is just 3 years away. And it's a good time to take stock as to where we are, what has been our journey, and what we want to progress from here on. The Millennium Development Goals have given way to the Sustainable Development Goals. And at this time, it's an absolute joy to say that while on certain parameters our country has not been faring too well, please check the Economic Times, there's a great article which has come out where out of 188 countries, we've been ranked at 143. But there are areas where we have done extremely well, where we as a people, where we as a government have intervened and have created some intervention philosophies into a healthcare setup. So clearly, when I look inwards to myself, there's a lot of conflict in what I do in terms of, besides the role of being president of an institution and being leadership for that institution, I serve as an association and council member in the revered CMC Vellore, and I'm also an executive committee member for the Christian Medical Association of India, which is clearly an area where there is a lot which is being done for the underserved. But today I wear my hat as the chairman for the CII Healthcare Subcommittee for the Eastern region, 5 states which is represented by y'all, Bihar, Chhattisgarh, Orissa, Jharkhand, and West Bengal. And I'm also a governing council member of Healthcare Federation of India, NatHealth, which was started off by none other than this amazing gentleman, Dr. Pratap Reddy, inspiring leader, motivator, who started off this overarching umbrella of an organization, Healthcare Federation of India. And clearly there are 2 different worlds. But when I take a step back and I look at this, I don't see conflict, I don't see divergence, I actually see a lot of convergence, a lot of learning, where I think all sets, all bodies, all partners can participate in the inclusive growth in this nation's progress and be a definitive player in the domain of healthcare, where I think a certain amount of compassion can be vested and reinstated into the enterprise, the private enterprise, and certainly the world of the NGO and the world of the compassion-based healthcare delivery systems can take a leaf or 2 out of valuations and ROI and how to be more efficient in the processes. Today it's a joy, it's an absolute privilege on behalf of CII to be able to have this august body. My absolute admiration for Association of Hospitals for Eastern India, and the leadership is also represented amongst you all over here. It's a great body of about 17 institutions in this part of the Eastern region, which is a great backbone and a great support for the CII Healthcare Committee. And definitely as NatHealth, I bring greetings to you from Mr. Anjan Bose, the Director General, as well as the Governing Council members. And they wish this conference a wonderful success and have a wonderful time as we progress from step on step. The 11th edition of Healthcare East. Can we give our participants a great big round of applause, please?